A decision to stop covering GLP-1 medications for weight loss through the OSU A&M Employee Health Plan has sparked considerable attention and debate. These drugs, which have gained popularity for their effectiveness in shedding pounds, will no longer be funded by the university system's insurance plan when prescribed solely for weight reduction purposes. But here's where it gets controversial. This move reveals the growing financial pressures faced by employer-sponsored health plans trying to balance innovation, costs, and sustainability. A recent comprehensive review of the OSU A&M Group Health Insurance Plan uncovered that the ongoing expense of covering GLP-1 medications for weight loss is becoming financially unfeasible. The price of these treatments threatens to disrupt the overall balance of the health plan, potentially compromising other benefits that employees rely on. Employees currently enrolled in the plan, who have already received prior authorization, can continue to have these medications covered until December 31st. However, for those newly prescribed these drugs or still navigating the authorization process, coverage will end after October 1st, meaning they'll have to shoulder the costs themselves or seek alternative treatments. It's important to keep in mind that GLP-1 medications prescribed for officially approved medical conditions, especially type 2 diabetes, for which they are FDA approved, will remain covered under the plan, following the usual policy terms. This distinction highlights how the health plan differentiates between coverage for medical necessity versus elective weight loss. To put these numbers into perspective, the OSU A&M Employee Health Plan is a substantial $90 million insurance program serving approximately 11,600 employees. Within just 1 year, 2024, the expenses related to GLP-1 weight loss drugs reached an astonishing $2.4 million. These costs have already surpassed that amount and are expected to continue climbing sharply as coverage is maintained. This rapid inflation in costs raises important questions about how sustainable it is to cover such expensive medications for large populations when budgets are limited. An internal communication to employees emphasized the gravity of this financial challenge. Maintaining coverage for these medications would drastically increase the overall costs of our health plan. This rise would likely force premium hikes and lead to reduced benefits for everyone enrolled. The message further explained that the difficult choice to cut coverage was made strategically. With the long-term viability and comprehensive nature of the insurance plan in mind, this controversial step opens the floor for many questions. Should weight loss medications like GLP-1 be treated differently when they can also impact public health positively? Can employer health plans realistically afford to support all the latest drugs regardless of cost, or must they draw the line somewhere? What might be the consequences for employees who rely on these medications for weight management, but now lose coverage? We encourage you to share your thoughts. Do you believe this decision strikes the right balance between cost and care? Or does it unfairly restrict access to potentially life-changing treatments? Join the conversation and let us know where you stand on this complex issue.